Hello, good evening friends. Myself Dr. Gayatri Deshpande. I am a consultant gynaec practicing since 17 years and I would like to discuss something very important today around the age of 40 years and plus. Okay, as you are all well aware of, our menarche, that is the initiation of the menstruation, starts at an early age of 9 to 10 years when we are actually schoolgirls, and from there onwards the regular menstruation cycle starts, which is mostly uninterrupted unless there are pregnancies. So it may last for 30 years, 35 years, till the age comes which is about 40 years and plus, till we attain a stage of menopause. So today we are just going to discuss what exactly the menopause means. Is it something to be really dreaded about? Do you really have a lot of anxieties regarding this event, and how to alleviate that kind of anxiety? So let us discuss very basic facts about menopause. Whenever a term menopause is actually meant, it is very simple. It is meno and pause. So your menstruation is coming at a pause. But scientifically, the WHO, that is World Health Organization, has defined it like it is a definition where there is cessation of the menstruation due to stoppage of the ovular function, meaning the ovaries degenerate as we age. So their capacity to ovulate, that is producing eggs, really reduce, and that's why the estrogens, which are the hormones secreted by the ovaries, they come to an end. So as soon as we approach the age of 40-45 years, it is always the estrogens go on, and there is another hormone which is secreted by the pituitary, that is a gland in our brain that decreases the FSH hormone. So FSH goes on increasing. So why am I telling this? That in case you have irregular cycles and you have a little doubt whether I am approaching menopause, this is the best test, the blood test you can actually do, which will tell us whether the menopause is approaching or there is some different reason for the irregularity of the cycle. Now, whenever I say the stoppage of the menstruation, it doesn't just stop like a magic that last 2 months the periods were going and now it is a complete full stop. It never happens that way. It's a gradual process where the periods will become less frequent. Meaning, suppose somebody has a cycle every 30 days. Rather than coming every 30 days, it will come every 2 months or 2.5, 3 months, and sometimes even there is a gap of more than 4 to 5 months. So, do you think it is normal? I would say it is definitely physiological and normal, unless whenever the cycle comes, it is not at all a heavy bleeding. So, ideally, whenever somebody is approaching menopause, remember 3 things. The menstruation should be little less frequent, so maybe more gaps, but the cycle flow should be less. So it should go scantier every time, and it shouldn't cause any episode of intermenstrual bleeding. So it shouldn't happen that there is unwarranted bleeding anytime. So any deviation from this kind of physiology or this kind of menstrual pattern definitely needs to be addressed. So suppose somebody is getting in an irregular cycle, but it is getting very, very heavy, out of control, then don't get worried. You can always approach first your family doctor or a consultant gynaec, whosoever is known to you. So we can figure it out by a simple test like sonography and the blood test, which will tell us the reason behind your problem. So as far as the menstrual irregularities are concerned, don't get worried if it is irregular, and approach a doctor. She will find out a solution for you. As far as the other changes of menopause are concerned, always remember the ovaries are actively secreting estrogen, which affects all the cells of your body. They say that from tip to top, all the cells in the body are responding to the estrogen hormone. So how do they respond? If you just consider right from your hair, a beautiful complexion, the sparkle in your eyes, the breast size, a feminine figure, as well as the basic good metabolic positive points in the female, meaning we have a lot of protection from the heart diseases. Consider if you just visit an ICU anytime with your relative, and you would realize that suppose there are 10 patients of ICU with myocardial or the cardiac problem, you will not see more than 2 females in that. I mean to say that out of 100% cardiac patients, hardly 10 or 20% are females, because till we attain menopause, we are nicely protected with the estrogens not to have any atherosclerotic effect or the coronary artery disease. In the simple language, we are protected from getting the heart attacks or myocardial infarction because of our estrogen hormones. So that's such a big boon to us. Similarly, whenever the estrogens are regular in our body, it will protect our bones from getting the osteoporotic changes. When I say osteoporosis, that means the bone has got a density, particularly our long bones like thigh bones, the humerus, the arm bones, they have got a specific density, particularly even the spine. So this density unfortunately goes on decreasing as we attain menopause. So that is really important to know how we can protect ourselves from being osteoporotic or from not getting the fractures of the bones. So one was a myocardial protection, second was an osteoporosis prevention, and the third and important is wherever our epithelium is there, it could be vaginal epithelium, it could be our skin, it could be even the coronal, that is the conjunctival epithelium. Everything gets a bit dry whenever the estrogens are reduced. So now you would realize why the females wrinkle after the age of 50. They have really loss of subcutaneous fat tissue, and that's why you actually age gracefully, they say, but the wrinkles are unavoidable. Secondly, the vaginal epithelium also gets dry, and people get a lot of irritation and dryness of vagina, and that's why they are more prone to get vaginal infection as well as urinary tract infection. The third important thing about menopause, I would always tell and counsel the patients, is about the hot flushes. I'll explain you exactly what a hot flush means. It is a typical feeling of a heat wave. This starts from your brain or from your head and goes up to your toes. It's like a heat wave going, and suddenly you feel a lot of perspiration and a lot of heat in your body. Without doing anything, this heat wave will reduce, and suddenly you become cold and you feel like having some kind of blanket or some kind of sweater. So this happens in a period of hardly 1 to 2 minutes. So this kind of wave with a heat wave followed by a lot of shivering kind of thing is typically called as hot flushes. But to be honest with you, all the females won't get exactly the same symptom. I have seen lots of my patients who really only get a lot of heat sensation even if the AC is full on in the bedrooms. And in those patients also, I tell them that please monitor how frequently these hot flushes are occurring. And if they are significant, when I say significant, that it is hampering your work, it is really hampering your normal household duties. Or somebody is an office goer and she is not able to concentrate because of the hot flushes. There is a definite answer for that. Okay, so if it is happening so regularly with you, don't really suffer from these hot flushes. This usually happens because of the fluctuation of estrogen hormone before the menopause actually is attained. So that phase of life we call as perimenopause, and it usually is 1 to 2 years before the complete menopause is achieved. So those 1 or 2 years, if you have these kind of difficulties, don't get panic at all. You can definitely come to the doctor, and most important, there are natural ways to overcome this issue. Apart from hot flushes, we have discussed osteoporosis, we have discussed the cardiac problems, and the most important, which is coming to our own interest, is how to avoid the recurrent vaginitis and how to avoid a recurrent urinary tract infection. So whenever I say recurrent vaginitis, any kind of discharge or any kind of irritation which is not getting relieved with simple moisturizer, number one. It is associated with some kind of foul smelling or little blood stained discharge. It is very painful and burning. Out of all these symptoms, if it is happening, it is not normal. So it's better that we should just find a solution for it. Similarly, some people get every 2 to 3 months a urinary tract infection. Why does this happen? Actually, the physiology is very simple, that our vaginal epithelium as well as the urinary tract epithelium, the lining is usually nice and thick till we attain menopause. Later on, the lining becomes very unusually thin, so it can catch infection very quickly. Also, there is one more reason for this, that there are some bacilli, like we have oral bacilli, which are friendly bacilli. Similarly, the vagina also has a lot of friendly bacilli which protect the body from getting infection. These are called lactobacilli. And lactobacilli are produced and maintained in a particular level by estrogen. And now when menopause is there and there are no more estrogens, the lactobacilli count really falls down. So if the lactobacilli reduce, then what it should be, it results into an atrophic vaginitis. That's a technical word, but in simple language, it will actually turn into a lot of irritation of the vagina. Sometimes the lot of infection actually can cause spotting in between the menses. Sometimes the intercourse becomes very, very painful for such ladies. And the irritation of the vagina makes you very uncomfortable. Getting urinary infection is a culmination of all these events. So whenever the irritation is definitely considerable and it is really troubling you, so we have to find a solution for this. Similarly, there are many ladies who actually don't have much problem with these kind of symptoms, but they feel a lot of mental health issues, meaning they exactly don't know what is wrong with them, but there is, just a minute, I'll just take a few minute break. There is a question coming by Pravina. Hi Pravina, your question is, what is hormone therapy for menopause? Yes, whenever it is a hormone therapy we consider, it is actually the replacement of the hormones, which is estrogen, and when the uterus is not there, then it is estrogen and progesterone. Okay, so whenever we replace the hormones, it is called as hormone therapy, or it is in our language, it is called as hormone replacement therapy. Now, I'll tell you, Pravina, what is the scenario right now. Initially, it started with the US ladies, US women, that they wanted to be young till the age of 75. So, blanket treatment was introduced more than about 20 years back, like in 1985 or 95, where all the ladies general were given the HRT. And when these ladies were followed up after for 10 years, they realized that the hormones are not necessarily healthy. They sometimes can increase the chances of cancer of breast as well as the cancer ovary. So again, the consensus was held. There was a big randomized trial, and the recent guidelines all over the globe, that is not even in America, but even England guidelines, Canadian guidelines, they say that there are specific indications to start hormone therapy. That should not be the first line of treatment. So I am going to discuss with you how to really reduce your symptoms rather than starting the hormone therapy. And let us come to the end of the symptoms now, Pravina, and I'll then talk to you about the therapy. So when I was telling you we just discussed about the myocardial problem, the osteoporotic problem, the vaginal infection, the urine infection, the hot flushes. Okay, out of this, what I was trying to tell you was each and every symptom may not be with all the ladies. Mostly, they either specifically come to me with a vaginal infection or hot flushes, or they don't have any kind of symptoms. They are just worried what will happen in menopause. So we will divide our treatment for class 1, class 2 and class 3 kind of ladies. Class 1 is they actually have the symptoms. Their lipid profile is haywire. They have osteoporotic changes. Sometimes they actually come with a fracture at an early age. And sometimes these ladies go into menopause before 50 years. So they definitely have a problem and we have to address it. So we actually have a joint consultation with 3 people. One is the consultant cardiologist or a physician who can handle the lipid profile. Secondly, a gynaec like me who can handle their estrogen deprivation symptoms. And number 3, the orthopedic surgeon who can actually treat them for the osteoporosis. So it is always a tailor-made treatment. In this also, we don't have exactly only the estrogen and progesterone, but we always think about some kind of alternative medicine, some kind of protective medicines, which are called as SERM, S-E-R-M. These are modulator medicines of estrogen. They are not exactly the hormones, but they regulate the symptoms and regulate the process of osteoporosis. So there are definite alternative medication apart from your lifestyle modification. Lifestyle modification like a healthy diet, a very good exercise, particularly anti-gravity muscles exercise will definitely have a positive effect on your lipid profile, on your osteoporosis, as well as the risk for the hot flushes and the cardiac problem. So remember that the first line of treatment for all these ladies will be lifestyle modification, followed by the alternative simple medicines, and if that doesn't really work, then the HRT. Vikram is asking me, how can I find the question is not complete. How can I find a menopause specialist? Okay. Menopause specialist is the specialist like a gynaec only who is running the menopause clinic. So she, as I told you, the menopause clinic is in collaboration with 3 consultants. At Nanavati, the menopause clinic is definitely there. And we have the orthopedic surgeon, the physician, as well as myself, the gynecologist. And as the patients need the treatment, accordingly we offer them the modification, and we have the nutritionist and the physiotherapist. Always remember, whenever there is a fracture risk, it is not only the density of the bone which is reduced, but it is the laxity of the muscle which reduces the balance of the body, and that will increase or that will precipitate a lady for getting a fracture. The other question which I am getting is by Preeti Mahadik, how do you know if you are perimenopausal? Excellent question, Preeti. As I told you, the perimenopause is about 2 to 3 years before the menopause is attained. So it may start from the age of 45 or 47, when your periods become irregular, periods become a bit scanty, and there are a lot of gaps between the 2 cycles. So in case this happens, and if it is associated with the symptoms of hot flushes or anything like mood swings, depressed mood, being tearful, very lonely feeling, all these symptoms if you get, then we normally do the simple blood test which is called as FSH, that is follicle stimulating hormone, and the estradiol, that is E2, not E3. So just do these blood tests, and according to the levels, we can detect whether you are heading for menopause, as there is still a lot of time. The second question is by Dhirendra Singh, what is the difference between the secondary amenorrhea and menopause? Excellent, Dhirendra. Whenever, what is amenorrhea, I'll explain for all the viewers. Whenever there is a cessation of periods, that is called amenorrhea. Whenever the girl doesn't attend menstruation, that is the menarche or the initiation of period doesn't occur till the age of 16, we call as primary amenorrhea. That means their ovaries are not active, they are not ovulating, so the culmination is she's just not getting the menarche. But for some ladies, the periods were already proper till some age and suddenly it stops. Now, secondary amenorrhea can be because of various reasons. It may not be the only menopause. Sometimes there could be some pathology in the uterine lining. The most common is the development of the synecdoche or the curtains inside the uterine cavity, which actually doesn't allow the periods to the endometrium lining to develop, and that's why the periods don't come. So these girls just stop the periods without any notice. So that is one of them, and that is called Asham syndrome. It can happen because of repeated curettage, repeated DNCs, and repeated abortions. The second important reason for secondary amenorrhea is for a short time, it could be a sudden weight gain and polycystic ovaries. They usually stop ovulating, and when the ovaries are not functioning and the ovulation doesn't happen, naturally there could be amenorrhea for 6 to 8 months or sometimes even 10 months, I see. So, as you asked me, this is totally different from attaining menopause. Usually these problems are faced at an early age rather than towards the 50 years of age. So, the differential diagnosis is done by one important modality, the transvaginal sonography. Second one is a hormone test, which tells us whether the ovulation is happening or not happening. The third question is, how do we really relate to the menopausal symptoms? Can menopause cause a woman's voice to change? Okay, yes, a little change can occur. I have seen particularly those who are, having a sudden menopause. They can get a little rough voice, like a man. Okay. Also, they get initially they didn't have any lot of hair growth on the face, but after menopause, many ladies get excessive hair growth on the chin as well as the upper lip. So, a change of voice, which is a very subtle one, can be a part of this change. And we can definitely control this with the correction of hormone. So many times it is self-limiting. So we should be addressing the issue and correcting it. So Geeta Jain has also joined us, and I would like to continue that I want to tell you something about the lifestyle modifications which all of you at your level can do before you come to a gynaec or before you actually start the hormone replacement therapy. Now, as I told you, there is a definite transformation of the physiology in your body. So whenever you are heading towards menopause, the cholesterol levels are really altering. As you may be knowing, there are different kinds of cholesterol in our body. To be simple, it's a good cholesterol, which is HDL, a bad cholesterol, that is LDL or VLDL. With the reduction of estrogen or approaching of the menopause, the LDL level will go up because of the liver metabolic changes. So with the same amount of whatever diet you are doing, your gain happens suddenly. That is the reason why it happens. Secondly, the LDL level will rise, even the triglycerides will rise. So how to control that? Always remember the requirement of calories as you age actually reduces. So if you can't really resist eating the complete full of plate, what you should do is just have a good portion of salad and fruit or a buttermilk before you start having the big lunch or big dinner. If you are going for a party, which dawat ke liye ja rahe hai, any wedding or any big party, particularly kitty parties and all, so always have some buttermilk or nimbu pani without sugar before you attend this. There is a simple logic for this. Whenever you are trying to eat, the stomach capacity is 1 liter. So if you fill up your stomach little bit, then the natural appetite will slightly go down. Your satiety level gets satisfied with a small portion of food. So automatically the amount of calories consumed will be less. Always remember, a little calorie consumption less will actually give you a benefit in long term. So this is a simple lifestyle modification with your diet. Similarly, whenever you those who are actually active physically, it's an excellent way to do it. But suppose somebody is very idle and you are not getting enough time to really do the physical workout, just do up and down in your premises, on your staircase. So how much ever slow you can, doesn't matter. But at least 20 minutes of up and down on your staircase for about 4 to 5 feet. That is also really good because it will gear up your anti-gravity muscles. It will help your legs to really gear up for a faster walk. It will prevent you from fractures in future. But being physically active is a boon after 40. I always say this. After 40, if you want to be fit, you have to be physically active. Anything apart from this, I think Neeraj has asked me, how long until hot flushes go away? Yes, I told you that it actually starts with the perimenopause and it ends with the menopause, but I have seen after post-menopause also, it may last for a couple of years. But believe me, it is just a fluctuation of estrogen and it will settle down in a couple of years. So I have to protect the patient, or you have to really take a alert step to protect yourself from hot flushes only for about 2 to 3 years. And as I was telling you, first was the diet, second was the physical activity. Now there are some tips to really prevent the hot flushes from being getting troublesome. First and foremost, never use a lot of synthetic clothes. It will really allow the body to breathe. Okay, then you will not unnecessarily get a lot of sweating. Particularly the undergarments, you shouldn't really use synthetic ones. That is most important tip. Secondly, you can have shower with the utmost warm water. Don't have hot water shower. It will really help you to control your body temperature as far as possible. Number 3, have lots of liquids in your normal schedule. Always carry something, either the electrolyte like a simple tang or nimbu pani without much sugar and coconut water, or some juices. But juices always, I prefer not to have the ready-made juices because it has a lot of preservatives, so that I don't really prefer. But have a lot of liquids, so it will hydrate your body. And particularly for the cramps, the hot flushes sometimes gives cramps in the legs. That can be very nicely covered. So these are a few things where the hot flushes you will be really comfortable. And if you really require, then you can definitely sit in the AC, have a good fan and the ventilation wherever you are sitting. And in spite of that, suppose this is not getting cured, there is a definite medicine which I called as SERM, SERM, which is an estrogen modulator, and it's a non-hormonal treatment. And this kind of treatment you can always give after consultation with a doctor for almost 6 to 8 months till the hot flushes completely recover. One question is coming to me, do I need to keep having cervical cancer screening test after menopause? Yes, Manisha. The guidelines say that after you attain menopause, you just have to do the cervical cancer screening once in 3 years, only for 2 sessions. Like suppose I have attained menopause at the age of 50, I'll do it at the age of 53 and 56. And if both the tests are perfect, I don't have to really go ahead for the screening anymore. Another question which is coming from Yasmin, is it safe to take dietary supplements or herbal therapies for my menopausal symptoms? See, whenever you say herbal, I really don't have any idea how far they are correct. Okay, always don't really rely on whenever they have a lot of advertisement for herbal therapy to lose weight, to have better hair, to have better skin. Always go into the details of the content. Or what I would say is there are good naturopaths available. So please take consultation with naturopaths there are a lot of small remedies in the kitchen which actually can give the replacement for herbal therapy. So that is more advisable rather than ready-made herbals, which we don't know. Sometimes they can contain steroids and then they don't mention on the pills. So please be careful about these products. Prachi has asked me, do all women get menopause symptoms? Yes, that is a very good question. As I told you, out of all the symptomatology, I have seen all the symptoms in a woman only in 10% cases. So whenever you are being active there, I told you there are 2-3 classes where when the women are all alone, they are isolated, they are less supported, they are being idle, and they don't have anybody to communicate. For them, the hot flushes, the mental symptoms of depression, being isolation, really getting a lot of mood swings, they are all much more common. Rather than the women who are active, they are having a good group, they are even working for their professional work, these people have an easy menopause. So always remember, Prachi, that each and every woman may not get the menopausal symptoms. Those who are very nicely physically active and taking a good, healthy diet rather than dietary supplements, these people are really blessed and they may have a very smooth menopause. Now coming to how do we actually prevent the osteoporosis? As I was telling you, that having a physical activity and the diet will really help you for the cholesterol. Similarly, osteoporosis, I just brief you how it happens. There is a process of the bone formation and bone disintegration happening in our body, particularly in the long bones, that is the thigh bone, the arm bones and the spine. These 3 bones are very important to be focused for bone density. There is a very specific test to measure the bone density, which is called DEXA. Never really depend on what is done in those camps with the foot on that. They don't really measure it in the right way. It is just a screening method. If you really want to know about osteoporosis, go to any good center where there is a DEXA. There is a DEXA machine which is measuring the bone mineralodensitometry. That is called BMD. Okay, it is bone mineralodensitometry, and they will measure in all these 3 organs. That is the spine, the bone, that is the thigh bone, as well as the wrist. Now, if you do the BMD, how does it show? I will not go into the technical details, but there are levels and the graph mentioned on the BMD paper. So whether you fall into the normal zone or a borderline zone or severe osteoporotic zone, that you should check your levels. Suppose you are forming in normal, it's very good, keep it up, go for the regular physical activity. But if you are falling into borderline, which we call as osteopenia, that means the BMD has reduced, but it has not really gone into osteoporotic level. This is the right time. Nothing to be worried about. You can always maintain your bone density, whatever level it is. Now, how to maintain your bone density? Remember, whenever you are in your youth, the bone actually increases in the density till the age of 40. After 40, whether you are a man or a woman, it is plateaued. So whatever the level of bone density you have reached, it will be flattened that time. It doesn't increase any further. But after the age of 50, it goes on a decline. They say that after you attain menopause, every 5 years, you reduce your bone density by 5%. So now with this scientific data in your mind, how much ever osteoporotic you are, you can actually measure after 5 years of menopause. So suppose I come to know that my bone density has reduced by 10%. So there is a minor risk of fracture in my thighs, in my spine and in my wrist. How to go about it? Again, there are some simple exercise patterns which we call as anti-gravity exercises, a good physiotherapist would be able to tell you. To prevent fracture, only bone density is not important, but the muscles around the bone, if they are strong, then it will hold the bone properly. So somebody who's prone for a fracture, it is not only that the bones have gone weak, but the muscles holding the bones really are reduced in the bulk. So that's why we say with regular physical exercise, your muscles will be maintained and they will be holding your joints properly. And that's why these things are definitely in your hand, not to have fracture at a younger age. There is one question coming now by Akshay. Are there any natural treatments available for menopausal symptoms? I think I have just answered this. It is basically the diet and lifestyle modifications and the relaxation exercises. The role of yoga therapy or role of pranayama and regular yoga exercises is very, very important. I have seen a lot of young girls, unfortunately those who go into premature ovarian failure. When I say premature ovarian failure, that means they attain menopause before the age of 40. I have got a couple of patients who are coming to me regularly. And as I told you, I have alleviated their symptoms initially for 6 months using a hormone therapy. But once they settle down, they are maintaining themselves with the yoga therapy. They are maintaining their weight, they are maintaining their bone density, as well as they are alleviated from the symptoms of hot flushes and the vaginal symptoms. So there are definite natural treatments like a healthy, very healthy diet, a good high fiber diet, lot of fresh fruits, good amount of hydration, and there are certain vitamin supplements like the soya products, isoflavins, and there is a capsule called Menopause, Menoise. These are also really good, rich in isoflavonoids. So isoflavonoids is a vitamin or a chemical ingredient or a nutritional ingredient which really helps you from getting these menopausal symptoms. So the natural therapy should be the first line of therapy rather than going into HRT. Apart from this, actually, what I was going to discuss with you was, in case you have got certain problems with your lipid profile, how to address that. And the most important thing, who are the women who are more prone for the diabetes. Okay, so let us discuss diabetes first and then the cholesterol problem. Whenever I say diabetes, there are 2-3 reasons. Number one, your genetic predisposition. Those who have parents, 1 or 2 parents, as well as the relatives having the diabetes, that is type 2. Type 2 meaning on oral medication, and which usually happens after the age of 30 or 35. Type 1 is which occurs at a very young age. So those who have type 2 diabetes in the parents or in the families, they have a definite high risk genetic predisposition for getting diabetes in their own life. Now, during menopausal stage, as I told you, the liver metabolism gets altered. So I have seen a lot of women getting type 2 diabetes when they are approaching their age of 50. So only menopause may not be the real reason for that. It is actually now the genetic predisposition is there, plus your lifestyle has changed. Suddenly you have become little idle. There is less amount of working output, that is the calorie consumption is less and the calorie intake is same. So whenever there is a balance, like suppose calorie intake is this much, and if your calorie output by the physical activity is same, you don't tend to put on weight. Okay, particularly on the trunk obesity is usually the reason for insulin resistance as well as getting type 2 diabetes. So if this happens, then usually it is an imbalance with the calorie intake and the consumption of calories. So if you don't have a lot of consumption, then your calorie intake should be reduced. Or if you cannot really reduce your intake, divide it into smaller portion so that your body can cope up with that very well. Similarly, the physical activity, some people may not be able to do at a stretch 40 minutes, 45 minutes work. workout, that is walk or jogging or gymming or whatever. So divide it into two portions. I always give the simple example. How many times you eat? At least 4 to 5 times in a day. So at least have exercise twice a day. Maybe small portion, but just keep yourself active rather than being a corporate. So what I was trying to say was, so type 2 diabetes, there are definite reasons of the physiology. One is a genetic predisposition and another is your whatever the imbalance of the calories. Number 3 reason is lack of estrogen because of the menopause. What I was trying to tell you was estrogens actually protect you from better metabolism of the lipids so that the LDL level doesn't go high. It actually really protects the liver. So whenever you are approaching menopause, please be aware of your lipid profile. So hence, I would always sincerely request all the women who are above 40, at least do the lipid profile once in a year. So it is like a mirror for you where you are heading for. So whenever you are having that kind of control, at least you get a very good guideline. I would always prefer not to give you any medication for the lipid profile. Rather than I would tell you that these are the guidelines. You should really control your diet and these things and then repeat after 3 months, after 6 months. The physicians are there to help you, to guide you. And that will not only prevent the diabetes, it will prevent the hypertension as well as the myocardial events in future. Somebody has joined and they are asking me whether the vaginal infections and the urinary infections are common. Okay, so I would just answer this, that urinary infections, if they are occurring without any precipitating reason, you please approach either a gynaec or a urologist and get yourself checked for the function of the kidneys as well as the urinary bladder. You should check whether there is a uterine prolapse or the bladder prolapse, which may be the reason for your recurrent urinary tract infection. So, to conclude, what I would say is, menopause is not a difficult condition. It is just a part of your normal physiology. If you are a little alert about it and you know the scientific facts behind it, your second inning, I would say, will be much more comfortable than what you expect. In fact, what I would say is, when your responsibility towards your family are coming to an end, this is the best time you can actually enjoy your life, travel abroad, travel inside the country, and enjoy yourself with a good health. All the best and good luck. Thank you.